Uncertainty in healthcare. Kenneth Arrow, 1963, wrote a paper, Uncertainty and Welfare Economics of Medical Care. This is one of the seminal papers one reads in health economics to understand the normative side of health economics. Kenneth Arrow was an American economist and he won a Nobel Prize in 1972. What is also more interesting is 5 of his students were also Nobel Prize winners. The scope of this paper is to look at the economics of the medical care industry from a normative perspective and not at health. So let's see his ideas on the medical care industry. What I have done is I am making a presentation on the core themes that Kenneth Arrow has stated in his paper, just to give you an insight into the various dimensions of healthcare industry, which is about the physician and the nature of the commodity that is being purchased in this particular industry. The first thing is about the special characteristics of the medical care market. In this market, when we use the term market, we know there is a supply of this commodity and there is a demand of a commodity. Here we are talking about medical care itself as a commodity and as a good. So this is one of those commodities which is demanded only when a person is ill. So it provides satisfaction to the purchaser of this commodity or the medical care good only during the event of illness, which is not true of any other commodity. The demand for medical care is irregular and it is unpredictable, just as examples of accidents and some kind of diseases that come to people. It is unpredictable. It is also irregular. We can also make about the idea of the consequence of falling ill, which he talks about the potential for earning loss. There's also the chances of a person succumbing to that illness, or it could be getting impaired from normal health after falling ill. So these are the risks that are involved. Besides these kind of risks, the other risk involved is the cost of purchasing the medical care and the loss of the potential for earning, which a person foregoes when a person is not well. The demand for medical care, unfortunately, is also associated with profitability, and therefore it is also understood as an assault on personal integrity. When a person is sick or when a person has met with an accident, there we find that the provider of the medical care is also guided by profit. So as a normative exposition of the medical care industry, he makes his observation about the expected behavior of physicians from an economic perspective. He compared sellers of commodities to the sellers of medical care as a commodity. And then he comments that these two are very different. In the case of medical care, which is a service, the producer or the production of the good and the product are identical. So the production is done by the doctor and the product that the doctor provides are the same. So that is a uniqueness about the product and production being identical. He also says that consumers cannot test the commodity before consuming. So there is no sampling possible of a commodity before the consumer actually consumes that commodity. So this whole consumption of medical care is it rests on the relationship that is built between the doctor and the patient. This element of trust is what drives this relationship between the patient and the doctor. The behavior of the physician, according to Kenneth, must be concerned with human welfare, how to improve the welfare of the person who is sick or not in good health, and this should be completely divorced from self interest. He does not say they should not be paid the charges for the services they rendered, but he makes this idea that it should not be driven by self-interest like it happens in other markets where it is profit maximization. Advertising and overt competition is virtually eliminated among physicians because this kind of service is not meant to be advertised, and there is no price competition in the service one provides. What should guide the treatment of a patient, and what should be the doctor's stand on this? According to Kenneth Arrow, the doctor must be as objective as he can about the needs of the patient, about the needs of the case, and should not be limited by the financial consideration of the sick. So here he's talking about the possibility that the patient is given the medical care even though he or she is not able to have the money to pay for that medical care. The physicians, according to him, have to be honest, and they should not do activities to please the customers. In which case, he gives this example that the physicians are the ones who can certify an illness, and the correct information should be shared, like how we seek this information and certification from a doctor in the case of joining an organization for employment or for an academic absence from an institution. So in all these cases, what we see is the doctor's certificate. So doctor's certificate means we have to trust the doctor. And the situation where profit in healthcare can raise antagonism and suspicion in the minds of the patient. So once the patient feels that the doctor is suggesting him activities which are meant to increase the profit for the doctor, then it creates resentment in the patient, and it's not a healthy relationship anymore. The patient and physician's relation is affected by the quality of the medical care product. So whatever is the relationship that builds between the doctor and the patient is based on that will affect the quality of medical care that the doctor gives to the patient. However, Kenneth Arrow also raises this point of conflict of interest. Patients depend on the doctor to act in their best interest. So, when the patient questions the best interest that the doctor has not been able to provide to him, this raises a conflict. What is that situation? A conflict of interest can happen because the doctor is selling a commodity to the patient. What is this commodity? Medical care. So when the doctor is selling this medical care to the patient, then there is a conflict that arises. This nature of conflict will be because the doctor is the one who determines the demand. Once the patient who goes to the doctor, the patient does not demand healthcare directly, but he demands healthcare through the physician. So the physician, on behalf of the patient, demands the healthcare. Then once he has demanded the healthcare, then who provides the healthcare? The same physician who has demanded the healthcare for the patient is the person who provides the healthcare. This can create a conflict in the relationship between this doctor and the patient if the patient loses that faith in the between the demand and the supply of that service by the same person. So when the demand and supply are jointly determined by the same person, then at the same time, then it can result in market failure, because there can be a loss of trust, and then the service may not be taken by the patient. Let's look at the kind of uncertainty that prevails in this particular market. It is very extremely difficult for patients to learn and evaluate consequences of purchasing the quality of medical care being taken. The patient does not know what will be the consequence of purchasing a particular kind of medical care. What will be the consequence of purchasing a particular set of prescriptions, drugs that have been prescribed by the doctor? What are going to be the consequences of that? The patient has no idea about it. There is an air of uncertainty for this patient about the consequence. The patient's uncertainty is also about the effectiveness of the medical treatment that has been suggested, that has been prescribed to cure his illness. So patient has his own uncertainty here whether the intervention the doctor has suggested will actually cure his illness or not. So that is the second kind of uncertainty that Arrow talks about. The third kind of an uncertainty is a complete recovery from the illness that the medical care is supposed to relieve him of. So will the medicines work as expected? Will the surgery heal him as expected? Will the treatment work as expected? So there is a question of uncertainty that the patient has about the medical care that he is demanding from the doctor. And also there is a variation in the utility of the healthcare that is available, which means for some people this might have worked, yet for others it may not have worked. So this also creates a certain kind of uncertainty in the minds of the patient who requires or who demands medical care. The medical care market is also a special case of asymmetrical information. When we mean asymmetrical information, we mean that the two agents who are interacting do not have the same level of information. One one agent has more information than the other. So the binding factor between the patient and the doctor is knowledge. And what is this knowledge about? The knowledge about the consequences and possibilities of treatment. So it is only the physician who has knowledge about the treatment. The physician is the only one who can suggest the lines of treatment and also how to manage the disease for at future recurrences. So these information is available only with the doctor and the patient has none of it. So one side is completely loaded with information and the other side has no information at all. So under these conditions of uncertainty, accurate information becomes a very valuable commodity. So the patient is going through so much of uncertainty, then the doctor's way of handling this information with this patient is the basis of becoming the healthcare becoming a valuable commodity. And medical care has, of course, two aspects. One is the technical aspect, which is the medicine and its way of treating the disease. The other one that Arrow suggests is that of interpersonal quality. The medical knowledge is a very complicated one and it is way beyond the knowledge of the patient, and that is accepted by both the parties. So both the physician and the patient knows that the physician knows all about the disease and the patient knows nothing about the disease. So the relationship between the two is colored by this knowledge. So the patient believes in trusts the doctor only because he knows that the doctor is knowledgeable about the illness that he is suffering. Now, this knowledge that the doctor has got a cost. So there is this information which has to incur the cost of production. So the doctor has spent resources on education, on training, and on experiences to treat patients, and therefore there is a cost of production of his knowledge. On the other hand, there is also a cost of transmitting this knowledge, which is in the hands of the patient and needs to be transmitted to the patient. This transmission of knowledge from the physician to the patient is such that he has to pay. Only when he pays for the transmission of knowledge can he get the benefit of the knowledge that the physician has. Since the physician has all of that knowledge, the physician can make profit out of it. And that is what Arrow talks about, the expected behavior of of the physician. Consumers, once they come to know this information, they can vary the cost of collecting the information. They can vary the benefits that they get from the information based on the incomes level of the patient. It can differ according to the knowledge level of the patient, and it can also differ because of the analytical abilities of the patient. So merely transmission of information from the physician to the doctor does not entail benefits to the patient. It depends upon the patient, his income level, whether he can go for more information or whether he can understand what the doctor has advised him to do, or whether he can he's educated enough to analyze the implications of what the physician has suggested to him. The other important element is the nature of information. The nature of information itself is very elusive character. Elusive because it cannot be contained in one way. The doctor has given the information. If the patient has grasped this information well, he has collected the information well. But if he has not been able to do it, that information has just vanished from the transaction that has taken place between the two patients, between the patient and the doctor. This sets the limit of marketability of the demand and supply. If the patient does not feel that the information that was shared with him did not satisfy him, then the market will fail. The patient may not seek the medical help or continue the medical help that the doctor was willing to give him. Now, it is also limited on the ability of the consumer. Now, the ability of the consumer is limited by the information and how to process that information, especially during a new or a recent illness or due to mental health conditions. For example, now during this pandemic situation, we have seen that doctors know quite a lot about it, and we knew nothing about it. And even then, when the doctors were trying to treat the patient, they were trying out many kinds of treatment that was possible. And therefore, there is a problem during the new or recent illness that can happen, and especially if it is that of a patient with a mental health problem, then the doctor's words become the final words, or the attender of the patient becomes a final word, because the patient himself may not be able to analyze the information that is being shared. So information sharing is a major part of the a transaction that takes place between the doctor and the patient. So buyers of information will not know the value of that information until they buy it. Just because the doctor is knowledgeable, the patient does not benefit. The patient has to buy that information from the doctor. And the patient knows less about the product value, the price, or the quality of the service that he is purchasing from the doctor than the doctor knows. So this is a major source of asymmetrical information, where the patient knows nothing about the medical service that he is purchasing. That is why Arrow says about the trust that is built between the doctor and the patient, and therefore the market of health can survive. Other, there will be a market failure in the health when this information that is shared between the doctor and the patient does not actually get accepted by the patient. Let's look at these supply conditions. He also mentions about the supply conditions of medical care industry, and he talks about the significant departure from the supply of neoclassical of supply of the doctors. So here he talks about the licensing system that is practiced for the supply of doctors, and when the licensing practices are done either by the doctors or the hospital industry, then this increases the cost of medical care. But at the same time, it is important for restrictions to be placed on the quality entrance into the industry or onto the hospital that can open up its services vis-a-vis the cost of education or the cost of setting up the hospital. So on one hand, the cost of setting up the hospital or the cost of educating the doctor. On the other hand, there is that importance of restricting the number of students who can become medical students, and also the quality of the students who can become doctors. He raises this issue of subsidies in healthcare. Subsidy is a part of the cost of education, of medical education, which is borne by the government. So, when a part of the cost of education is borne by the government, there is a subsidy. Actually, with this subsidy, he suggests that the cost of production of healthcare must subside because the cost of the production of the doctor has been partly paid by the state. But then he argues this way, that the short supply of doctors is a reason for the increasing cost of medical care. So the quantity and quality of medical care is also influenced by non-market or by social factors. Social factors by the status and the loyalty and the recognition. These other factors also influence the supply of doctors in the society. Let us also quickly look at the pricing practices. The health industry has got this practice of price discrimination. We talk about price discrimination mainly because in a particular locality, the doctor is a monopolist. He is the only one providing the service, and therefore he is free to charge the consultation charges as he may please to do. So this causes price discrimination. But then Kenneth Arrow also says that price discrimination can be practiced when doctors together form a monopoly, collective monopoly, and can start working. So once they become a collective monopoly, all the doctors in a particular monopoly or hospital can practice price discrimination, and then this could also affect people and their healthcare demands. He argues that price discrimination by income is not a bad idea because those people who cannot pay the market price for the health may be actually supported by this kind of price discrimination. The other issue that he raises in the pricing practices by the health care industry is that of the prepayment option, where he says that it is unethical to withhold treatment to people who are not able to deposit a certain amount of money before even the treatment starts off for the patient. So he was against it, and the reason why this is practiced is because we find that many patients are not able to pay after getting the treatment, like what we have seen in many of the situation where people have not been able to pay the hospital charges for being admitted into the hospital after after being infected by COVID. In such cases, it becomes extremely difficult for the hospitals also to collect the money from the sick patient, or if the patient has died, the relatives may not be in a position to pay. So this prepayment collection that he talks about as an unethical practice, this unethical practice is also done by hospitals because of the health insurance schemes that are prevalent, where the health insurance would have covered up the cost of health insurance up to a certain amount, and a certain portion has to be covered by the patient who is insured. So the time that the insurance company may take to pay off the cost of the treatment may be quite long, and to cover that, the hospitals may collect a prepayment from the patient before they actually start the treatment of the patient. So this he considers as unethical. So the main theme of Kenneth Arrow's paper is that of uncertainty that arises in the market, the peculiar character of demand for healthcare, the expectations from the doctor as that of trust and of the relationship based on knowledge, and finally how the pricing market works, and how the unethical practice of prepayment in this medical industry works. Thank you very much.